Do you think miscarriages can be prevented? If you've been having recurrent miscarriages or you're afraid, I'm going to list out ways for you to prevent having a miscarriage. Hi guys, and welcome back to my channel. My name is NG, and if you're a returning subscriber, welcome back to this channel. And if this is your first time joining us, welcome to the channel, okay? So this channel basically focuses on health and wellness generally, women's health and skincare, as well as some lifestyle vlogs that I'll be dropping from time to time. So please watch my videos, okay? And support this small YouTuber right here. So today we are going to be discussing about miscarriages and ways to prevent having miscarriages. So, a miscarriage is basically the spontaneous loss of a pregnancy before the baby is viable, usually in the first 20 weeks of pregnancy. And as we all know, there are actually different types of miscarriages, okay? So, people have miscarriages, but there are certain types of miscarriages. So, that's what we're going to be discussing shortly here. The first one would be threatened miscarriage, okay? So, in threatened miscarriage, there is vaginal bleeding, there is abdominal pain or mild cramps. The person may have spotting, all right, but there is no cervical dilatation or cervical changes, and also the cervical os is closed here. So that is the threatened miscarriage, and this threatened miscarriage usually occurs in the first trimester. So in cases like this, we give medications like progesterone, okay, to keep the uterus relaxed so that it would help to prevent the person from having that miscarriage. The second type of miscarriage would be the inevitable miscarriage. So here you would have severe vaginal bleeding and also abdominal pain that is usually worse than that of threatened miscarriage. And in this circumstance, the cervix is dilated, but no fetal tissues are passed. And when a pelvic ultrasound scan is done, it usually shows the product of conception at the cervical canal or lower uterine segment. The next one would be incomplete miscarriage. So in incomplete miscarriage, there's vaginal bleeding, there's abdominal pain, there's passage of tissues, okay, because the cervix is dilated in this case. And when you do a pelvic scan, it will show retained products of conception. The fourth type of miscarriage would be the complete miscarriage. So in this case, there's vaginal bleeding, abdominal pain, passage of tissues, okay, and the abdominal pain usually stops after there's like complete evacuation. Everything has passed out. So in this case, you find that the cervical os is usually closed, and an abdominal or pelvic ultrasound scan rather would confirm the diagnosis that this is a complete miscarriage. The last but not the least would be a missed miscarriage. So this is a non-viable pregnancy, meaning that the fetus is already not alive, okay, in the womb, and there are no signs of vaginal bleeding or abdominal pain. So a pelvic ultrasound scan usually diagnoses or confirms this type of miscarriage. Miscarriages are not uncommon, and there are certain factors that can lead to having a miscarriage, of which some of them are just unavoidable. Like, you can't really do much about it. Like in cases of having chromosomal abnormalities that can predispose one or put one at risk of having a miscarriage. So talking about chromosomal abnormalities, I have a video up on this channel where I talked about the different causes of miscarriages and possible interventions to that. So if you've not watched that video, go back and watch it because it's very informative and it is well loaded. Okay? Yeah. So about 10 to 20% of pregnancies are expected to end in miscarriages. Researches have been done and studies have shown that. However, there are certain factors, like I said earlier, that can, increase one's chances of having a miscarriage. And we're going to be discussing that right now. The first one would be maternal age. So people that are advanced age-wise, okay, they tend to be at a higher risk of having miscarriages than the younger ones. It doesn't mean that people in their 20s that are married and pregnant wouldn't have miscarriages, but like studies have shown that the percentage of women aged 35 and above, okay, they are usually at risk of having miscarriages, and the percentage is expected to be around 20 to 60%, okay, and that is because of the advanced age of the person. Next up would be previous history of miscarriages. So if you've had a miscarriage in the past, it puts you at a higher risk of having a recurrent miscarriage or a miscarriage in a present pregnancy than someone that haven't had a miscarriage before. Third one here would be chronic medical conditions like uncontrolled diabetes. It tends to put one at a risk of having miscarriages than people that do not have these conditions. So I said uncontrolled, meaning that if you have diabetes mellitus and it is well controlled, the risk would tend to be lower. But in a situation where the diabetes is not well controlled, it puts you at a higher risk of having a miscarriage. Another factor would be weight. So people that are underweight and people that are overweight are at risk of having miscarriages. Underweight, we calculate this with your BMI, the body mass index. So if your BMI is less than 18, it means that you're underweight. And if your BMI is more than 25, it means that you're overweight. So if you fall under any of this category, you're actually at risk of having a miscarriage. Another important point would be lifestyle factors. Smoking, alcohol consumption puts you at a higher risk of having a miscarriage. The last one would be ethnicity. So miscarriages are commoner in the black race, okay? But it doesn't mean that Caucasians or white people do not have miscarriages, but these are basically done based on statistics and calculations from researches that are done. So studies have shown that miscarriages are commoner in black people than whites. We've listed out the different factors that can put one at risk of having a miscarriage. Now let's go into the main message of the day, which is how can you prevent having a miscarriage? So the first one here would be proper treatment of chronic medical conditions, cases of diabetes mellitus or hypertension. In this case, you're pregnant and you have any of these conditions, properly treat them by taking the prescriptions you're given by your gynecologist, okay, and follow up with your checkups, routine medical check. So keeping this under control would, prevent you from having a miscarriage. The second point would be folic acid supplementation. Folic acid is very important, okay, so there's a recommended dose of folic acid for one to take when the person is pregnant. And why is this important? Because it prevents you from having children that have birth defects or even worse, having a miscarriage. So you can see how important taking folic acid is. I discussed this in a previous video where I listed out the supplements that you have to take when you're trying to get pregnant and during pregnancy. So if you've not watched that video, then you have to head back and watch the video so that you get the full information and follow us. So folic acid, very important to prevent neural tube defects and even prevent you from having miscarriages. Apart from folic acid, there are other different supplements that you can take during pregnancy that will help you to achieve a healthy pregnancy. Vitamin B, okay, B complex vitamins, vitamin C, calcium, vitamin D, they are all important. Another thing is that you should avoid taking cod liver oil or any supplements that contains vitamin A, because taking too much vitamin A, which is retinol, can actually harm your baby. The third way for you to prevent having a miscarriage in your wonderful pregnancy would be lifestyle adjustments, okay? So quitting smoking is very important. I've emphasized and overemphasized on the importance of stopping smoking, especially for people that are trying to conceive or that are already pregnant. So, every cigarette that you take contains about 4,000 chemicals, and these chemicals, when you smoke, you inhale, it gets to your baby and it limits the oxygen supply getting to that baby. And we all know the importance of oxygen. So when the baby is not getting enough oxygen, inhaling toxic chemicals in the womb, what do you expect? It tends to increase the risk of having a miscarriage. Not just miscarriage, it even causes more damage. So it can cause you to have stillbirth, premature birth, or even babies that have low birth weights. So I'm going to talk about the benefits of quitting smoking in pregnancy. Women that do not smoke in pregnancy tend to give birth to babies with normal birth weights. Women that smoke, they give birth to babies that are usually lighter in weight compared to people that don't. Another benefit of quitting smoking is that it reduces the risk of sudden infant death or cot death. So it's an unexplained death of an apparently healthy baby. So you can see this is due to the mother smoking while the mother was pregnant. So you just give birth and suddenly your baby dies. The baby that is very healthy just dies for no reason. Quitting smoking would reduce your risk of having this. While we're still talking about lifestyle factors, just like I talked about smoking, the next one would be alcohol intake. So avoid taking alcohol in pregnancy. because, every person, okay, let's just talk about the normal situation here. Every person that takes alcohol, once you take it, gets to the liver where it is metabolized and excreted in urine through the kidneys. But when you're pregnant and you take alcohol, it goes through the bloodstream, through the placenta, gets to the liver of the baby that is not fully developed, so it can't be processed. Okay, so it would cause problems with the development of the baby. It can cause a condition known as alcohol spectrum disorders, which affects the physical and mental development of a child. So when you have babies like that, it is something that you as a parent wouldn't even be happy about. And in worst cases, even while the baby is still developing, it can cause a miscarriage to happen. Still under lifestyle factors, if you're used to taking caffeine, please stop it and reduce your intake of that because it can increase your risk of having a miscarriage. Another thing would be having a good weight or healthy weight in pregnancy. So if your BMI is above 30, it puts you at risk of having a miscarriage. So try to lose some weight, okay, if you're on the big side. Then eating a healthy, balanced diet in pregnancy is like 100% thing for you. It would help, all right? So when you eat healthy, about 5 portions of fruits and vegetables in a day. The fourth point or way of preventing having a miscarriage would be regular medical checks. So when you're pregnant, especially in your first trimester, please follow up with your OBGYN. Okay, to monitor the pregnancy, to do series of investigations, make sure you're taking your medications to check the condition of the baby, the well-being of the child. At some point in time, you might be requested to do an ultrasound scan to check the fetal well-being, okay? To be sure everything is fine. So that if there is any problem detected, it will be detected early and sorted out so that it wouldn't be like you coming late when the problem is already has caused the damage and there is nothing that can be done. So regular checks, very important. The next on the list would be treating infections, pelvic infections, okay? So if you have, while you're pregnant, you're experiencing any vaginal discharge, spotting, painful urination, please visit your OBGYN to check. If this is a sexually transmitted infection, it will be treated, okay? And this would help to prevent you having complications in that pregnancy, like having a miscarriage. The last point would be treating an identifiable cause, okay, that could make you to have a miscarriage. So if you've gone to the hospital and your OBGYN requested for some investigations and you had some abnormal findings from those tests, so it would be best for such things to be handled the right way so that you wouldn't have a miscarriage. This brings us to the end of this video. If you liked this video, please give it a thumbs up. Please like my videos, comment, and most importantly, subscribe to my channel for you to get notifications whenever I post this type of videos. And we're going to call it a day for now. And I can't wait to see you on my next video. Bye.